Spending too long playing Angry Birds may be bad for your blood pressure, but there are plenty of apps which are actually good for your health.
Yes, the Department of Health has compiled a list of 500 apps for doctors to prescribe to help patients with conditions as varied as diabetes and depression. Well, with us is Dr Shaibal Roy from the Future Forum, who helped compile this list. And joining us live from Lincolnshire is Phil O'Connell, the inventor of one of the apps. Well, Dr Roy, if I could first start with you. Talk to us about this list of apps. What can we find on this list to help patients?
Sure, well, there are existing apps and there are ideas for new apps. But if you just cut to the top 10, you can see apps for things that improve mental health. There are apps to help control long-term conditions. There are apps to help manage your food allergies. There are, I could obviously go on, but what's really amazing about the work is that we've managed to unearth an incredible collection of things that we just didn't know existed.
Because this was almost a competition by the government, wasn't it, for members of the public to submit their ideas for apps, and it's become this list of 500. What, for example, are you recommending to patients? What are the apps that you're talking to them about right now?
Well, the apps that I tell colleagues about that I think will make a huge difference are the ones to do with how you actually keep up with how you control your own management. So, for example, I mean, the example I've got here is just fantastic. But then if you can use an app to record your information and then manage it yourself, then it can really help you stay on top of something like asthma or diabetes. But the ones that I really tell colleagues about to go and check out themselves are ones where you can, for example, check in different languages, different types of ailments if you were stranded overseas.
Well, let's go now up to Lincolnshire and this Flow app and the proud inventor. Tell us about it. What does Flow do?
Well, Flow is an application that clinicians use on a smartphone and on PCs, but it actually links a clinician through to the patient via the patient's own mobile phones. So, for example, if a patient needs a blood pressure checking, rather than going into the surgery to do that, the system, Florence, will send a prompt to the patient reminding them they need to do it. The patient can take their reading through a normal blood pressure meter and then use SMS and text from any mobile phone to send it back into the system, at which point the system will assess the data that's been sent in and make a recommendation back to the patient automatically. So it might say that the blood pressure is fine, no problems, or it can act as a safety net and say your blood pressure is a bit high, maybe you should think about behaving in this way. Or if it's a bit dangerous, it'll tell the patient to actually call the GP or call the nurse, and it can send alerts to those to the nurses as well. And it's used in many different pathways. We mentioned earlier diabetes, COPD. It's used with mental health patients. There's been a non-threatening and easily used and easily accessible method of patients actually taking their medication and recording information themselves.
Now, you actually came up with this idea yourself from working with the health service, and you've given the app, if you like, to the health service. I mean, is it going to really cut down on work and cost, do you think? Yes, it certainly is. Some of the groups that have been using this, it's a new innovation, just been running for 18 months, but some of the groups that were early adopters are now expanding the services out dramatically because they've managed to save so much time from, for example, in Lincolnshire where I am at the moment, the traffic can be horrendous moving from place to place. And so if you can avoid one of those visits, an unnecessary visit for either the patient travelling to a surgery or a clinician travelling to a patient, and the data can be transferred by the system safely, then it's definitely saving time and money. And in some of the projects we've done with GPs, we found it's helped to get the diagnosis right and avoids white coat syndrome as well. So patients might record a high blood pressure in surgery, but when they do this at home at their own time and their own convenience, the blood pressure might be perfectly fine. Of course, Dr. I suppose there's a danger the patient might make a mess of it and send in the wrong blood pressure.
Well, I didn't hear anything like that this morning. We had an event that gathered together many of the people that put forward really compelling examples, and the stories from patients are really, they're just in many ways they're inspiring.
This is never going to replace a one-to-one appointment with a GP though, is it? If you're concerned about your health, you're not really going to trust what your smartphone says, are you?
Well, I think it's fair to say that these sorts of innovations, they should be there to support the way people work. I don't think any of the app developers or any of the innovators I met this morning are suggesting you replace them.
I mean, I don't know. I was talking to one doctor who said, well, you know, we don't need stethoscopes anymore. We can do it on our iPhone. Is that true?
There are some apps. There's a great app actually for ECGs, but maybe that's a bit too geeky for right now.
What does that do?
Well, you basically put it on your chest, your iPhone, and you need a special sleeve or an attachment for it, and then you can see your heart rate. It's pretty cool.
Give you a heart monitor. So it's true, you don't need a stethoscope.
I would suggest that the stethoscope is rather helpful if you know what you're listening for.
It does rely on the NHS being very technologically savvy, though, doesn't it? I mean, some GP surgeries aren't even that up on email.
That's true. I think rather than think about it as a technology issue, it's definitely more of a cultural issue. And just this morning, everyone was saying that these are no-brainer ideas. You know, how do you actually get everyone to do it?
And what in your view, Mr. O'Connell, would be the silver bullet of apps?
I think the key thing for these apps is to help clinicians to actually carry out their own roles and their own pathways as they do at the moment. So it's not about changing the pathway. It's not about changing the interaction with the clinician and making it higher risk. This is about actually helping the patient help themselves.
Our show for today, I'm afraid. Bold & Co. Coming up next, Anna Jones.